Bismillahirrahmanirrahim. Assalamualaikum and a very good morning to all participants, moderator and panelists. My name is Najmin, and on behalf of the Center for Translational Research and Epidemiology, I would like to extend a very warm welcome to all of you to our fifth clinical research webinar series. So ladies and gentlemen, before we begin further, just a little housekeeping announcement. If you have any question during the forum, please type down in a Q&A or chat box in your Zoom control panel. And you can also watch the forum through our FB Live at our Facebook, Center Medic UiTM. For those who are just joining us, welcome. Last year, on the 25th January 2020, the first case of COVID-19 was detected in Malaysia. After more than 1.5 years, we still see a staggering number of new COVID-19 cases, for more than 11,000 as of yesterday. So a lot of activities has to be put on hold or slow down. Businesses, education, tourism, and for research, it's no exception. So for today's topic, overcoming the hurdle of slow participant recruitment in COVID-19 era, we have two amazing panelists who will be sharing their thoughts and insight with us. And to further introduce them both, I would like to invite our coordinator, Dr. Nurhida Baharudin, who is in charge of Center in Selayang Campus, Faculty of Medicine, UiTM. Without further ado, would you please welcome Dr. Nurhida.
Thank you very much, Ms. Najmin. Welcome to webinar series hosted by Center. I'm Dr. Nurhida, your moderator for the forum today. So welcome, and hopefully we will all have a great time this morning to hear some thoughts from our experienced panelists. So first, let me introduce your two panelists for today. The first panel is Prof. Dr. Rohana binti Abdul Ghani. So Prof. Dr. Rohana Abdul Ghani is a consultant endocrinologist, professor of medicine, and the Deputy Dean of Postgraduate and Professional Training, Faculty of Medicine in UiTM. She is no stranger to various research in the field of medicine and also endocrinology, some of which are conducted at Center. She has vast experience leading industry-sponsored research as well as investigator-initiated research. Among many notable international research grants, she is the national leader for semaglutide cardiovascular outcome trial in patients with type 2 diabetes, or known as SOUL trial. The output of her research has been published in many peer-reviewed index journals, both locally and internationally. She is a reviewer for many local and international journals, such as the BMC Endocrine Disorder, as well as a member of the Faculty of Medicine Research Ethics Committee and the Senior Editorial Board for the faculty's journal, the Journal of Clinical Health Science. In addition to her active involvement in research, she is a member of Writing Committee for Malaysian Clinical Practice Guidelines of Type 2 Diabetes mellitus, as well as the Malaysian Clinical Practice Guidelines on Obesity. So welcome, Prof. Rohana. Okay, so
Thank you.
Okay, now let's move on to the next panelist. Okay, so the next panel is Prof. Dr. Safura Ramli. She is a consultant family physician, professor of family medicine, and also the Deputy Director and Principal Fellow at I-PPerForM, a research center of excellence in UiTM. Her research niche area is in the prevention and management of cardiovascular risk, particularly hypertension, diabetes, hypercholesterolemia, obesity, and metabolic syndrome. She has published numerous scientific research papers in international high-impact journals and has vast experience in leading research team as principal investigator of national and international grants. She was awarded with the Newton Unku Umar Funds Medical Research Councils, or known as NOAF MRC International Research Grant, for her investigator-initiated research collaboration with the University of Nottingham, amounting to close to 1 million ringgit. So this is certainly noteworthy and inspiring to many of us in the Faculty of Medicine. Her team has won several research and innovation awards at national and international levels, including UiTM Best Researcher Award in the year of 2020. Her research interests include e-health intervention research, health service research, and also the primary care reform research. So please welcome Prof. Dr. Anis Safura to the forum.
Assalamualaikum and good morning, ladies and gentlemen. Thank you.
All right. So the next part of the forum is opening speech by the panelists. Now I would like to invite the first panel, Prof. Dr. Rohana, for her opening statements. Welcome, Prof. Rohana.
Hi, Assalamualaikum and a very good morning, ladies and gentlemen. Thank you very much, Dr. Nahida, as the moderator for this morning. And also, I'm very privileged and very honored to be sharing the platform with our esteemed researcher, Prof. Dr. Anis Safura. He's a friend of mine. Perhaps this is a very interesting topic, I would say. And what we hope to do today is also to get a very lively discussion about what's happening at ground level when our researchers are facing all these predicaments during this COVID-19. So perhaps just very quickly, Hida, if you allow me.
Yep, please.
I'm just going to share some of the points that I've prepared in just putting my thoughts down in terms of, you know, what are the problems and how we can overcome this. So the topic given this morning is overcoming the hurdle of research participation recruitment in this era. So perhaps I can just start the discussion rolling by highlighting this, that these are some of the issues that we constantly face, regardless of whether it's COVID or not, probably escalated during this period of time. And that is, number one, the major hurdle is this thing that patients will perceive as being the guinea pig. You know, they actually say that word, I'm a guinea pig to you. I'm a lab rat. You know, I'm just a testing conduit for you. So this is something that saddens me because they're absolutely not. And so that kind of reflects patients' general poor knowledge on clinical trials that you have to handle. And also they are very much exposed to the World Wide Web, which most of the time can be useful in terms of providing information, but without proper guidance and proper the correct points for them to read, this may actually be misleading and therefore, you know, giving a problem to overall research activities. And other than that, I think our community are very dependent on family members, friends, and colleagues. Some of them actually say to you or to us or to me, it depends on you, doctor. So that makes me uncomfortable because then I'm deciding for them. But on the other hand, you also have family members who have their interests at heart, I'm sure, but again, providing the wrong information to the patient. So these are some of the problems that I know I face and my team faces, and I'm sure you all face as well. So the key strategies, just very quickly, and again, this will bring us to the many points that we'll be discussing today. Some of the things that we implement is to look at the previous study patients, because some of our study patients from previous studies, they have known us for a long time, and they're actually very happy with the remuneration, with the treatment that they're getting. They have a special clinic to attend, so, and they're seeing us all the time. It's the same face, so they get very comfortable with that. Anis has moved to a different venue. As previous study patients, so we kind of invite them, would you like to join our other studies as well? So known patients to us, long-time patients, these are much easier to approach because they have established their rapport, they trust you that you're going to be looking after them. So these are the ones that you want to target first, I think. Secondly is, again, to explain to patients and be as honest as possible. Students tend to forget this, that when you have a proposal and you just say the advantage is that I get to complete my MEd program. So that should not be your highlight when you're discussing it with the patient. You have to be very clear on how it will benefit them in terms of identifying pre-diabetes, for example, by performing the OGTT. And if you're talking about intervention, you know, how it benefits them in terms of reducing sugar, reducing weight, etc., etc. And also you must explain that if you fall into the placebo, you also will be looked after very closely by our team. So things like this that patients want to hear, how it will benefit them. If you cannot say that, then the other thing that you also have to highlight is, without people like you, we will not have these medications or these new medications that we have so far. Other than that is to involve family members very, very closely, especially the younger children who are very concerned about the parents, of course, but probably again to give them the adequate information regarding the intervention they're giving. On the other side, on the right-hand side, there is probably on the academic point of view that you really need to plan your study adequately. I see a lot of students who do not have this in mind, that and also researchers, you have to have adequate recruitment time as per your study duration. So be very wary that this can actually affect your graduation time. Okay, so again, other than that is the appropriate inclusion and exclusion criteria, and this may be a bit dynamic as you go on through the study, because as you see, when you recruit them, if you have difficulty, you might need to revise this criteria appropriately, not to change your methodology per se, but perhaps to allow all this, unprecedented or unanticipated problems. But what I want to highlight here is observe your timeline very, very closely for the clinical studies. And this particularly goes to the research coordinators, that when you have a timeline, when the recruitment is either competitive or limited, then you really have to sit down and plan with your researchers on how many of your targets that you are, the target number of patients that you want to recruit. So just be very, 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 very wary about this. And if you have difficulty with one place they're recruiting from, you might need to discuss in terms of expanding that. So these are some of the strategies, Hida. That's all from my slides. Thank you very much. I'll stop sharing now.
Okay, thank you very much, Prof. Dr. Rohana. So she pointed out some interesting issues arising from the pandemic, and some strategies also to address them. So we are really hoping to explore them further throughout this forum. So our next panel is Prof. Dr. Anis, my respected colleague and also my mentor from my very own department, the Department of Primary Care Medicine, UiTM. So Prof. Anis, what has your experience been like conducting research during this pandemic? What are your difficulties and perhaps any positive silver lining arising from conducting research during pandemic?
Assalamualaikum warahmatullahi ta'ala wabarakatuh, and a very good morning to all our honored participants. I can see that 52 people have actually joined this session this morning, so I'm very pleased. I thought it's just going to be less than 10 people. So thank you so much for joining us. I'm not as organized as our Prof. Rohana. She's got beautiful slides that she has shared and summarized everything for us this morning. I'm just gonna go with the flow with Dr. Hida. So she has posed some questions for me there. So I'm just going to pick up on our experience based on my own project and our project actually. So the question was, Dr. Hida, what was the challenges, is it not, the experience in conducting our research during the COVID-19 pandemic? So I'm going to pick up on the three active research projects that we have at the moment and give examples from there. How do we overcome this particular problem on the participants' recruitment and how do we handle it? So the first project that I'm going to draw your attention is our international research project, collaboration with the University of Nottingham in the UK. Is funded by the Newton Unku Omar Foundation. It's called the FemCat project. It's a new tool developed by University of Nottingham, and it's the first time that we are testing outside the UK. So Malaysia is privileged to be collaborating with the University of Nottingham, which is ranked as number 99 in the world, according to the QS ranking. So that's a bit of background about that particular project. So, and another project that I'm going to draw attention today is on the Empower Sustain project that we have, another active project funded by the Ministry of Higher Education, PRGS, Prototype Research Grant Scheme, which is ending soon. And another project that I'm going to talk about is actually on our metabolomic study, traditional complementary medicine. A small project, nevertheless very important. Again, it's nationally funded by FRGS RACER. The PI is Dr. Karatul Naini, and I am the senior mentor in that particular project. So drawing on this, how do we overcome our challenges? Okay. So with regards to the North FemCat project, we were actually awarded the grant at the end of 2019. So in the beginning of 2020, we were just gearing up for data collection, which was actually supposed to start by May. Unfortunately, COVID-19 hit us, as you all know, the whole world, by March 2020. So the whole world went into lockdown. So obviously, we didn't panic, but obviously we have to strategize, basically. How do we overcome this? So what our team did during the early part of the study is to prepare the members regarding these challenges. So we actually used the time during the lockdown to ensure that everything is settled. For example, ethics approval, because when we had the grant, awarded the grant in December, the ethics was not approved yet. So there were a lot of things that we need to do regarding ethics. So we had to apply to two different institutions, which is the UiTM Ethics Committee, as well as the NMRR, Ministry of Health. So many documents to prepare as well. And Alhamdulillah, at that time, we've already identified our sites. So there were 11 sites altogether that we have identified by January. So by the time COVID hit us, we already have recruited the 12 sites, Ministry of Health clinic within Klang Valley, which is Selangor and Wilayah Persekutuan. So Alhamdulillah, we managed to get the ethics settled by the end of May. And that was during the first lockdown. So we did not do any data collection then. And then came July. I remember last year, there was an opening a bit for us to start data collection. So we were gearing up to that. And by August, we already did training for our co-investigators on data collection. And then by October, we were collecting data already. So the message I'm going to get to you is, despite the challenges of COVID-19 PKP, PB, PKPD, and whatever PKP that we have, you just have to, just go along with it and do whatever you can within your limitation. Don't give up. So that's what our team did. And Alhamdulillah, from the 11 sites that we have now, 50% done in terms of our data collection, despite the multiple PKP, whatever we have that is challenging us. So I'm just going to stop there. Otherwise, Prof. Rohana, I'm sure she wants to share as well. So that's what we have done for our North FemCat project. So the message is, you just have to be focused, committed, get a good team, because I'm very fortunate that we have a very good, committed and focused research team behind me. And also another thing is you need committed students as well. So you need to identify the right students to be doing the project with you. So we have two GRA, Graduate Research Assistants, doing Master of Science project for the North FemCat. So that's all I'm going to share for now regarding North FemCat, and later on I'll share a bit more regarding the other two projects. Thank you, Dr. Hida.
Thank you
Over
very
to you.
much, Prof. Dr. Hadis, for her very insightful sharing session with all of us. So perhaps the next question is, I would like to ask either Prof. Dr. Rohana or Prof. Dr. Anis, just to expand further from what Prof. Anis has talked to us about earlier. So, she mentioned about, some key points to take home is keep going, have a strong team members, have a strong students, just ride the wave, I suppose, to make sure that your research keep on going. Yeah. So perhaps, just to zoom a bit more, what are the adjustment or modifications that you have to do to ensure that we get enough sample size for your research? So yes, I'll open the floor to either Prof. Anis or Prof. Rohana.
Right. Perhaps I can start, Anis. So I think just zooming in on the actual timeline during this COVID pandemic, I'm not going to refer to any particular patient study per se, but perhaps a little bit. There was one study that is with my PhD that I'm co-supervising from UPM. She was supposed to start, and Monash, there's two of them, they're supposed to start beginning of the year, but we anticipated, because it's all about planning. I would like to emphasize the word planning. And I think not to be gender biased, but I think ladies tend to plan a bit more anyway, so but we had planned it perfectly. The numbers were coming down by the end of last year. So we were very hopeful that we can start it by beginning of this year. We did not anticipate that it just skyrocketed after a particular election at a particular state, but it went up really, really high. And then again, it was locked down again. So that one we didn't anticipate. But when we were actually planning to recruit, what we could do was pre-screening. Okay, so as I said, you haven't really started the study, but you can actually look through your clinic database and identify those patients and try to get as many as possible. You cannot talk to the patients if you haven't gotten your REC approval yet. But if you have, then you can actually approach them by phone and say, we're recruiting you, we're starting very soon and all that. So the other one was actually during the study visits or the anticipated study visits or the planned study visits can actually be done during their clinic visit. So and that is if patients are very willing. So patients are willing to come, so you bring them with the letter to clinic, so you can actually recruit them. And I think in UiTM is probably the only place that is a little bit strict in terms of monitoring. But other than that, student visits are actually allowed. So now I think we're moving towards opening up. So those are some of the steps that we did. And then the full-blown intervention, we have to do it either virtually or by phone a bit later. But once you've established that relationship with the patient, then you're quite all right.
Thank you very much, Prof. Rohana. So over to Prof. Anis now. Did you have anything that you'd like to add?
Yeah, so the question is the adjustment or modifications that we had to do, whether to the protocol or of our study. The thing that we did with our project, referring to the NUOFMCAT, again, the first thing that I did as a principal investigator for this project is to actually request for an extension. Because for an international project, the extension did not come automatically. We actually had to request. So I acted promptly to request for an extension from the Ministry of Higher Education, because even though Ministry of Higher Education wasn't the grant provider, they were actually the one who were monitoring the progress of this project. So presentations, progress report actually had to be done at the KPT level, and they are the ones who are actually granting the extension as well. So in May 2020, I requested for the first extension for this particular grant, and Alhamdulillah, we were granted 6 months. So rather than ending by the end of this year, because it's a 2-year project, it's supposed to be end by December this year, we have managed to extend it until June next year. So that's the first thing that any PI should have done regarding adjustment. But we did not alter the protocol or alter any of the study size. The sample size has been calculated, and we need to recruit 300. We need to actually find at least 310 patients from these 11 clinics who's eligible to be tested for genetic testing. So we did not actually modify that. With regards to other national grants like PRGS or FRGS RACER, we're very lucky that we did not have to ask for the extension because it came automatically. For PRGS, the first extension that was given by the KPT was automatic 3 months. And then as there was multiple PKPs affecting us, KPT has kindly extended it another 6 months. So in total, for all the KPT grants, all PIs, all research projects were extended by an automatic of 9 months, which is very, very helpful. So that's one modification, which I think very, very useful. So you have to be proactive if your grant provider doesn't do this for you. And Alhamdulillah, if your grant provider is already doing it for you. So that's one strategy that we did. Another thing is about student, because each of these projects have got students attached to it. So you really have to know your students' progress in terms of their level, in terms of their Master of Science or PhD attached to this project. And take all the opportunities given by the university, because Prof. Rohana can confirm this. UiTM has been very kind in giving the COVID-19 leave for 6 months for students at the early part of the study. So Alhamdulillah, all my 3 students are at the early part of the study. So they all applied for the COVID-19 leave for 6 months, where they don't have to pay the tuition fee for that 6 months. However, they are not active student for that 6 months. But the plus point is that 6 months is not counted towards their graduate on time semester count. As we're all going for GOT for our students attached to this project. So I think that's another strategy that all PIs should have thought about when we are faced with this pandemic. So Alhamdulillah, all our students managed to get that 6 months extension. With regards to the metabolomic study, the FRGS RACER, our student was collecting data okay at that time, because her data collection involved our own clinic in UiTM Selayang and Sungai Buloh campus. So she was not affected in the beginning because our clinic was open. The patients were still willing to be recruited for this study. It's just a simple cross-sectional study, taking blood samples to look at the metabolic profiles among those metabolic syndrome patients taking TCM, traditional complementary medicine. So her data collection was not affected. It was just recently that it was affected because the lab closed. During this second pandemic, the metabolomic profiling lab run by Orins was totally shut down. So she couldn't actually process her data, process her blood sample. So because of this, she had to apply for the COVID list as well, because it was affecting her. Otherwise, she's not able to actually graduate on time, because she's due for her write-up already in this October semester. So Alhamdulillah, she has applied for this, and we're still waiting for the approval. I hope it has approved, yeah, Prof. Rohana? That means her current semester will not be counted, and she'll be okay, because even now, Orins is still a bit slow in terms of opening up. They have opened up now. The reason for closing down the lab is because many of the lab staff was not vaccinated before. So Alhamdulillah, we all worked hard to vaccinate almost 90% of the population now, so that we can get going with our lives or in a data collection in this particular session. Okay, that's all. Over to you back, Dr. Hida.
Thank you very much, Prof. Dr. Anis, for sharing with us her very detailed, I suppose, encounters with many of the research under her wing. And I'm sure the fellow researchers as well as the students can learn from the experience, or perhaps the difficulty that she's gone through and how she overcame those, yeah? So I suppose the next question is perhaps, to Prof. Dr. Rohana, with her experience as part of the member of the Faculty Research Ethics Committee. So both of the panel have, the common theme described by both panel that you need to have a good planning, factor in the pandemics in your research planning to ensure that you have enough time to complete your research. But unfortunately, with the nature of research, unexpected or unprecedented things happen. So you have to troubleshoot and find your way to get enough sample size. So, Prof. Rohana, what kind of situation that perhaps the students or fellow researchers need to submit amendments to the ethics committee, to cater for the changes or amendments, in the data collection process?
Okay, that is a very valid question, Hida. Though I must say that a lot of our researchers are not aware of it. So that this is a good platform to discuss it, I suppose. And if any of the members of the audience want to actually raise a specific subject, because I wouldn't be able to give you an exhaustive list, then please feel free to do so. But some of the things that's written in is probably the main thing is duration. So there's always that because of that delay in recruitment, for example, then the changes in terms of the duration of the study. So instead of 1 year, it's extended to 2 years. So again, I would like to remind everybody that do that very early on when you anticipate the delay, because if you don't, and then the term expires by right, you're not supposed to continue the study. So those makes it a bit tricky. Other than that, if you, as I said, I mentioned earlier, if you need to change your inclusion exclusion criteria by right, because that is a major change in the protocol, you need to write this in. So for example, you initially wanted to target, I'm just giving an example. Hida hates it when I give example of diabetes, but that's the only thing I have in mind. But say you want to recruit HbA1c between 6 to 8, but then your recruitment becomes really almost impossible because you're not getting enough. So you want to include 6 to 10, for example. So those kind of things you just have to write in. In terms of REC, we're not very particular because we understand the situation, and we're not going to question the scientific, the reason why you're doing that in the scientific validity. By right, we shouldn't. But in general, for example, HbA1c of more than 10%, then we question, because these are involving high risk patients, for example. Other than that, in terms of numbers, you might want to write in to say, instead of recruiting 120 or 550, that's your usual HIDA, your students have got humongous numbers compared to ours. Then you want to write in to just a simple cover letter to say we have reduced it in anticipation or because of the COVID-19 poor recruitment. But you have to also provide the justification in terms of the sample size, because sample size calculation has been performed. So you need to justify that the sample size has been recalculated based on more recent papers, for example, and that is acceptable. These are some of the things. If Anis can think of anything else on top of my head, I have none at the moment. But I also welcome anyone who has any questions in terms of this. Please put your questions in the chat box.
Yes, Prof. Anis, hand over to you.
Yeah, so this is about planning for new research study. How do you factor the pandemic into your study design, data collection, recruitment procedures, and all? Okay, I'm going to refer this because I'm sure many of our audience today, among the 62 of you watching, are probably students, some of our postgraduate students, some of our clinical master students as well. So just drawing attention to what kind of research in my field, we normally do small studies as well, cross-sectional study, surveys using questionnaires. So this kind of research, you can actually adjust and modify according to the pandemic situation that we have now. So rather than face-to-face data collection method, you need to factor into your proposal a virtual data collection method using questionnaire, where you can actually design the questionnaire using a Google form and request for ethics approval for the Google form. So it needs to be planned from the beginning rather than, put it a face-to-face data collection method using questionnaire and then later on thinking, oh, now I'm going to convert it into Google form. So it doesn't work that way. So you actually have to plan it from the beginning, because there is specific ethics related to how you actually design your Google form in terms of taking the consent online for the ethics committee to approve. So you need to put this consideration in mind. Another thing is when you actually do the study design, not the study design particularly, it's about your sample population and your research topic as well. I would do something which is pragmatic and practical in terms of your sample population. Don't choose a difficult sampling where you have to actually approach vulnerable groups, for example, people with HIV, pregnant teenagers, for example, in this pandemic era, where you know that it is not suitable to be collecting online data from this vulnerable population. These are the population that you need to see face-to-face. So I will absolutely avoid, if I'm the supervisor, I will avoid sampling vulnerable populations during this pandemic, because we need to be practical. Otherwise, you will not be able to collect your data. So that's the second point. Another point that I'm going to make is actually, it's not just about challenges, opportunities as well. So rather than thinking about doing a difficult research with vulnerable populations, I know it could be your research interest, but put the interest aside for the moment and take the opportunity, because what the pandemic offers us is opportunity for venturing into a new area, such as COVID-19 itself. So there are many grants now at the university level, as well as national and international levels, inviting researchers to do research related to COVID-19. So you're more likely to be granted a funding if you actually find opportunities in this. I'm not an expert in infectious disease, but even I do research related to COVID-19 at the moment, not as a principal investigator, but I was invited by a team from USM, headed by Professor Azida, who's a consultant family physician, family medicine specialist there in USM, a longtime friend, whom I've known since our days in the conjoint. So she recently invited me to join her team to do a research in primary care related to COVID-19, involving developing new questionnaires, as well as qualitative research in relation to COVID-19. So do something like that. And Alhamdulillah, our research team has been granted the recent FRGS by the Ministry of Higher Education. So you can see here that if you actually apply for in relation to COVID, you're more likely to get the funding at the moment. So use it as an opportunity as well if you are actually designing a new study. That's all. Thank you. Over to you, Dr. Hida.
Thank you very much, Prof. Dr. Anis, for ever inspiring speech. So just if I could summarize, the gist from what both panel, have spoken about, of course, number one, have a proper planning, factoring in a pandemic into your research design. Make sure that you have enough time to complete your research. Make sure that, the data collection procedure, would, consider pandemic, such as, not only face-to-face, but also think about alternative methods such as, online questionnaire. And of course, things don't go as planned. If you've stumbled across, difficulty, if you have to make amendments, please do so. Actually, not please, definitely do so, because the essence of conducting research is you have to be ethical. So what Prof. Dr. Rohana said, anything that involves, I suppose, a deviation from your initial methods, yes, such as changing your inclusion/exclusion criteria, changing your recruitment procedure, all of those require submission of amendments to your institution ethics committee. All right, so the next question is just to discuss a bit on ethics here. As Prof. Anis, Prof. Rohana, and myself, we are clinicians. So patients coming into the clinic, seeing us as a doctor, that's a given, there's no ethics there. But, when you do a research, perhaps you could argue that this patient do not need to come to the clinic in the context of research. Furthermore, your research team, especially URA, who might perhaps not be the medical professional themselves, needing to be seeing this patient. So let's discuss about the ethics behind conducting research during pandemic. So so I'll open the floor to either Prof. Rohana or Prof. Anis.
Maybe I'll let Prof. Anis go first.
Sorry, Dr. Hida, can you repeat that question? I was distracted by a silent phone call just now. So you mentioned about ethics.
Yeah. So the ethics conducting research during pandemic, because I suppose you could argue these are, a non-compulsory activity by us researchers. So how do you argue that it's still ethical to do research during pandemic?
All right. Okay. I think this is a non-issue, because if you look at developed countries, they actually do more research during the pandemic. They never closed down their lab, for example. So I actually am puzzled. Why is it that we actually have to close our labs during COVID-19, especially during the first lockdown in March last year, when nobody could move and even go out of the house? If you look at how developed countries actually deal with the pandemic, they never close down research. Okay. Right. With regards to research involving patients, of course, there will be ethics involved. Like, for example, my area is involving participants who are vulnerable to get COVID-19, for example, COVID-19 complications. I'm saying everybody is vulnerable to get COVID-19, but they are vulnerable to get the complications. We're talking about elderlies, people with multiple comorbidities like hypertension, diabetes, and so on. So of course there is ethics involved here. So that's why, drawing up to our NOAA FEMCAT as well, because we are actually recruiting patients as such. When we want to identify familial hypercholesterolemia among them. So we're very, very careful in terms of participant selection, that we don't want to risk our patients unnecessarily, and patients do not want to be a risk as well. So I think that's the reason why we actually delayed our data collection during the earlier part of the pandemic, because number one, we don't know much about COVID-19 itself at that time, as the knowledge on it was still evolving. Number two, the vaccines was nowhere to be seen in 2020. All of us were unvaccinated. So I think that's the reason we delayed until October. And that was during the PKPB bersyarat, where people actually can move about. But then things evolved. We know more about COVID-19 this year. And we actually, about the ethics itself, Ministry of Health, for example, NMR never actually sent us a letter to say, please stop data collection from our health clinic. Because if it's so unethical to be actually collecting data from this patient, I'm sure our NMR would have done that, but they never. None of the ethics committee has ever written to us to say stop data collection now, especially involving patients high risk of getting COVID-19 complications. So we just have to use our own judgment, basically, in terms of, yes, we want to go along with the data collection. At the same time, we want to protect our patients as well as our research team. So for 2021, for example, in the early part of the year, we managed to collect data as it was allowed by the syarat PKP or PKPB at that time. But then we went into another lockdown from 1st of June, if you remember. So from 1st of June, what our research team did was totally stop data collection, and we concentrate on vaccinating people. So many of my students, graduate research assistants at that time, my research assistants were not vaccinated. So I was very concerned about their health as well. Even though they are young people, they can catch COVID while collecting data and bring it to their vulnerable family members who may then ended up with COVID-19 complication, stage 5, and so on and so forth. So I actually stopped, as a PI, I made a decision to actually stop data collection at that time and fight for my RAs to be vaccinated as soon as possible. So that's what I did as a PI. Another thing is actually, what we did was I geared up everybody in my research team to help in the PPV to vaccinate people, because that is the solution. We need to get everybody, almost 90% of the population vaccinated, so that we can we can continue doing and living with COVID-19, because I don't think it's going to go away anytime soon. So we we actually focused our energy and effort doing that in July and August 2021. Only now that more than 80% of the population are now vaccinated, then currently we are resuming back with our data collection. So as we speak now, this afternoon, we have an online meeting to organize data collection in one of the Klinik Kesihatan, Klinik Kesihatan Tanglin this afternoon. And also this Friday as well, we've got appointment to see our colleagues from KK Selayang Baru to start off data collection again. And KK Kelanajaya, for example, we have started even a few weeks ago, since we are opening up again with 90% of the population reaching vaccinations, complete vaccination status now. So yes, I don't believe it is I believe it is unethical to stop research during COVID-19. We just have to balance between protecting our team, protecting our patients, protecting ourselves, with the interest of the research, because we just have to live with it and find ways and means in order to live with the virus. Thank you.
Thank you, Prof. Dr. Anis. I certainly agree with you that the COVID is not going anywhere. It's going to be part of our life. We just have to learn to live with it. Considering that into the equation, perhaps, that should not stop us from doing what we think is right. Yeah. So, Prof. Rohana, do you have anything to add to the topic?
Yeah, Hida, that's why I wanted to see what Anu says about it, because I wish we can have a poll, to be honest, among our participants here, and to say, do you think is unethical? Because it is very, very sad that, to me as a clinician, I feel sad that the patients who are waiting to go under surgery for malignancy, waiting to come in for any elective procedures, have to be postponed because of this COVID. So really, are we doing justice to them just because we are saying that we don't want them to get COVID, and things like that? So similarly, really to the point that, does the world stop because of COVID? So absolutely not, right? Because in terms of research is a fundamental part of new knowledge in the scientific world. That's my understanding of it. So if you stop with knowledge, that's when humanity goes down. Humanity, it hinges on development and progress, and that hinges on scientific research. So that's the very reason, first and foremost, in my portfolio as Deputy Dean, we actually wrote to TNCA at the time very early on to allow our labs to open. Even despite the actual, MCO, I don't know what, PKP, whatever, and something else, yang very ketat-ketat lah. So even at that time, we actually wrote to say we have to continue because we've already delayed them for a year, right? So students are demotivated, they're staying at home, poor internet, they can't do anything, they can't move because they have research work in lab work to work on, they have no data, things like that. On the note of clinical research pula, to a certain degree, yes, vaccination is one of the solutions. But we do have data to say that some of the vaccinated people can actually carry the virus and bring them home as well. So that may not protect the whole family members 100%. So for those purposes, we actually, for our patients, for example, and vice versa. So either the patients give to the doctors give to the patients. So I completely agree to some degree that the clinical research can be done. If you can prevent that, it can be done virtual, for example, you can do so. So you can opt for a virtual clinic visit, for example, versus an actual physical clinic visit, knowing that risk is there. So you can minimize the risk. But at the same time, you do have patients who are experiencing all these adverse events, for example, a diabetic foot that you cannot see virtual. So they need to come in. So you have to kind of like weigh the pros and cons of it, the advantage versus disadvantage. So in those situations, REC per se is very concerned when we mention that clinic visits have been changed to virtual clinic visits because of the pandemic. And they are very concerned that, are we seeing our patients adequately enough? To a certain degree, there might be that risk of missing out something, unless if patients come to the clinic, you actually look at them from head to toe, right? But in the virtual, you go like, anything? Do you have anything to show us? Things like that. So you really have to know, and this is where the RC plays a role. So RC the research coordinators would have a much closer relationship with the patients. So they are the frontliners in a way, because then they ask, are you okay? Have you been experiencing anything unwell? Because some patients tend to talk to them more than they talk to the doctors. That's my experience with my RA, that is. And then they will tell, and then my RA will tell me that this patient has been experiencing headaches, for example. They won't tell the doctor because they think it's nothing. So things like that you kind of have to look at. But overall, essentially, as I said, research is very, very important despite all this. There you go. We can have a poll. We should have asked that before we actually answer the questions, Najmeen and Aisha. Never mind.
So yeah, Prof. Rohana and Prof. Anis, we do have the results of the poll here. So
we do already.
Yeah, well, we're still going. So as of now, 100% thinks that it is ethical to continue the research, and we should, but it's still going. So, we'll perhaps, summarize the outcome of our poll at the end of the session. So, so to the participants, please keep registering your answer to the poll. We're quite interested to know what you think. Okay, all right. So I think we are nearing the end of our forum. So I guess the gist of our session today, coming back to the objective of the forum, overcoming the hurdles of slow participant recruitment during pandemic. So perhaps, some take-home message that I can give
Dr.
out
Ida,
for today.
if I may interrupt there,
sure.
I actually have a point to add to what Prof. Rohana has said about postponing our, a routine clinical service while continuing research. To be honest with you, I think that is unethical. If we postpone our routine clinical service, not willing to see our patients in clinic or postponing our routine surgeries and stuff like that because, giving COVID as an excuse, while continuing research and data collection, I think that is unethical on the part of the clinician researcher. So the way I will approach this as a clinician researcher is, for example, in primary care, we never closed down our clinic. Even during the first lockdown in March last year, when we don't know much about COVID, we gave our patients a choice, whether you want to see us virtually, whether you prefer a telephone call, or whether you still are willing to come and see us in the clinic. So I personally, I never closed down my chronic disease management clinic, cardiovascular risk factor management clinic, looking after my patients who've got hypertension, diabetes, dyslipidemia, obesity, and so on. So I actually gave back that option to the patients. And from my own experience running our service during this pandemic, only in the first lockdown that the patients were not willing actually to come, because we all don't know much about the condition then. So we did a virtual clinic only during that 3 months. But after that, we've been opening our clinic as usual, but with strict SOP, social distancing. We actually reduced down the number of the patients to avoid congestion in the waiting room. And we've been continuing per usual with the proper PPE and so on. And to our surprise, many of my patients, for example, even though they've got, penyakit 3-4 serangkai that puts them at risk of COVID-19 complication, they are still willing to come to the clinic and see us. Actually, they look forward to come and see us and actually show to the police, see police, I've got an appointment to see such and such doctor. It's actually a treat out of their home to come and see us. So I'm very glad. So alhamdulillah, I've never I have not caught any COVID-19 from any of my patients. My patients have not caught any condition from me, so and the infection from me. So alhamdulillah for that. So I hope it will continue that way. But I think we have to give that option to the patients. As a doctor, I think we have to continue with our responsibility. Our colleagues, family medicine specialist colleagues in clinic kesihatan never work from home even for one day. They've always been, in their clinic, on the go, on the run, looking after their patients, doing either virtual clinic if the patient wants a virtual clinic, or seeing them face to face if the patients are willing to come to the clinic. So I think we have to empower back, that to our patients to have a choice. So it is ethical to continue with research as long as you are still seeing patients, as we all should be as doctors. So that's all that I have to add on that point. Thank
you very much, Prof. Adi. So I'm glad to see, those positive spirits in the house, So the pandemic, after all, is not gloom and doom. So we live with it. We find ways to, I suppose, coexist with COVID, because as we mentioned earlier, it's not going anywhere anytime soon. Perhaps, just some, closing remarks, I suppose, what are the positive silver lining, perhaps, that we've learned, throughout the last 1.5 years living with COVID? In terms of research, what are the positive things that COVID has done to us, I suppose, for the lack of better word to describe it? So hand over the floor to either Prof. Rohana or Prof. Anis.
Right, perhaps I can close first. I think the main learning point, I think, to all of us is probably that we learn to improvise, right, Ida? I mean, you learn to make Google forms that you've never done before. You learn to make all these technical thingies that I'm completely illiterate to. We learn the hardship, you know, the things that is difficult, and you kind of just have to move on and just go around it or just go over it or whatever. But if you allow me to give one point that I would like to share with the younger, because we are considered older, not old, but older. So the younger colleagues that we have here, we have quite a considerable number. I appreciate you dialing in, but do talk to your seniors, do talk to your colleagues. Doesn't have to be seniors, okay? So it might be experienced, might be younger, but experience, and try to sort the problems out and getting their ideas, because it's all about experience. It's not so much knowledge, because you know, these things, all this hardship gives you experience, right? So knowledge comes in other ways. But what I have found recently is that suddenly all these problems came up, and then it's too late. We can't help you because it's too late. You have delayed your research by a year because you couldn't recruit patients and you couldn't recruit students. You couldn't get students. But 2 years and 1 year has lapsed, and you didn't do anything, and you didn't talk to anybody. And now we're trying to help you, but it's really difficult because, you know, we're almost at the end of your research duration, for example. So approach anybody that you're familiar with, and then if they can't help you, then they might be able to tell you who to approach, but approach the right people lah. Right? So, you know, things like that. So do not be shy. Do not think that we're not going to belittle you, because we understand all these hardships again comes with the experience. We've had our share of hardship, and it just makes you stronger. So things like that. So although we might look stern and serious most of the time, mastery things that I don't talk about anything else other than work. Hida, do you know that?
No, I did not.
Yeah, so he said I don't say anything, I don't talk about anything else other than work. So it seems, well, although we might look serious and we're stern, and because, you know, that's our job profile maybe, but if you come to us or any of our colleagues, we should be able to help you.
Okay, so over to you, Prof. Anis. Some positive lining, I suppose, from COVID.
Yeah, Prof. Rohana, I think we suffer the same fate. Some of my colleagues think that I don't talk anything else but research and where to publish, when to publish, whether we've got papers accepted. So, but okay, yeah, so key points I can summarize from this webinar on overcoming the hurdles. I think this COVID-19 pandemic has actually tested our leadership skills, I think, as a principal investigator, as a co-investigator, and even as a student, because we have to remember that we are leaders in our capacity, in whatever capacity that we play in a research team. So it taught us how to manage our time, because suddenly we have so much time. We're all at home, and we're not allowed to do this and that. And you know, at some point we were not even allowed to exercise, you remember? So managing time at home, I think, is the biggest challenge, you know, for all of us to do it, including doing research and actually what to do with the time at home. So this actually tests how to, you know, make your day more colorful. So during this COVID-19 pandemic, our research team has learned how to conduct virtual meetings such as this webinar. I find that this webinar is professionally conducted with all those musics and all from the beginning there. I'm sure we don't know to do any of this before the pandemic. And with our international collaborators too, we've been having online virtual meeting even before pandemic, but not so many before the pandemic. But since the pandemic, since everybody's at home, we actually have been doing it every month at least, if not twice a month. So we're very much in touch with our international collaborators too. And another thing that we have improvised is actually looking at manuscripts online with our students. So it's not just about data collection. There's so much that you can actually generate, to generate output during this pandemic. So whenever you cannot collect data, we concentrate on our manuscripts. So we actually have manuscript meetings after meetings and get it submitted, answer to the reviewers' comment, and all of this has been done online. And preparing our students, for example, for DRP, all online now. So I think that there's a lot of hikmah that has come to us during this pandemic. It doesn't mean that our job has stopped and we cannot do anything much. So apart from leadership, I think there's another two things that has tested us in terms of our resilience and be able to adapt with challenges. So that's another thing that I learned, that I'm so lucky to have a committed and focused research team who are resilient and willing to work with me. And another thing, last but not least, is grit. I learned this particular vocab from Dr. Sharif. He introduced us a book written by Miss Angela Duckworth, who's a psychologist. He made all of us actually read that book, and we now know that according to research that the most important characteristics or that is most important to ensure you're successful, a successful person in terms of your career or life achievements is actually grit. So what it means is the ability to run a marathon with full of passion, commitment, dedication, without actually losing the spirit to do it. So I think this is what we have learned, and we have actually inculcated into our research team for everybody to have grit in order to achieve our short-term and long-term goals in whatever we do in terms of research, producing research outputs, in terms of our academic career, in terms of anything in life. Even with your family, you can actually inculcate a grit to achieve milestones in our lives. So with that, 3 key points, I will end this on my part. Thank you, Dr. Hida, over to you.
Thank you very much, Prof. Dr. Anis. So just to add on the grit, from the reading that I've done with my student who actually wrote a paper on association between grit and the academic performance of the medical students. In our literature review, we also found that the student who is gritty do not suffer as much stress, academic stress during pandemic. So there you go, enhance your grit, surround yourself with gritty people. And with that, you hope you will be able to endure any difficulties you face in your career. All right, so now we're moving on to the
We're all
question
very
and
gritty
answer.
now, Hida. Thanks to you and Sharif.
Yeah, so we're moving on to the Q&A session. We have one question from one of the participants. Yeah, so how to redesign project when needs participant recruitment, which needs participant recruitment when you have only 1 year to finish your grant. So this particular participant had only 1 year left in her grant. So she's concerned, or he's concerned, how we're going to redesign the project when we only have 1 year left. So over to either Prof. Rohana or Prof. Anis.
I think we've kind of covered all the points that you can do. I think in summary, I think you need to write in, if you can extend the grant for at least another, 6 months to a year. At least you ask for a year, if they give you 6 months, at least you've got 6 months. That's first thing that you need to do. And by right, the sponsor should be able to grant you that extension. Secondly, as I said, you might need to look a little bit in the sample size. That's probably the easiest, if you can recalculate the sample size. And then look at the inclusion exclusion criteria. If you can broaden it or just lax it a little bit for you to be able to recruit more patients. Other than that, it's probably to incorporate more sites, and you need to engage more people maybe to help you recruit it, and that would include the help from your other team members. Yeah, that's essentially it, I think.
Yeah, just to extend on what Prof. Rohana said, this is from my personal experience submitting amendments for my research. If you check, if it involves, the amendments of the inclusion, exclusion criteria, recruitment methods, that takes a lot longer. But if the amendment is just to extend your research, and number 2, to add study sites or add investigators, that takes hardly a month. Yeah, so I think it's worth it to consider. Yeah, adding sites, adding co-researcher, if it's required, and extend your study. Yeah. All right. So Prof. Anis, would you like to, do you have anything to share with us?
I think you pretty much, yeah, you pretty much covered it there, I think. And look at how you sample your data as well. If you're doing a cross-sectional study using questionnaire, you may have to look into online data collection using Google Form. However, if the ethics has been approved for the online, for the face-to-face, then as Dr. Hida mentioned and Prof. Rohana mentioned, you need to actually rewrite the method section and send for another ethics. So that takes a bit of time. And I know a lot of researchers feel that, it's a burden or it's an obstacle to do that, but it's worth considering it, and write to your grant provider as well to extend. Most of them actually do understand. I think for internal grant, everybody gets 6 months extension, if I'm not mistaken. And as I mentioned, for KPT grants, it's automatic 9 months. So that should be plenty of time for you to readjust your sampling method, data collection method, and so on.
Okay, thank you very much, Prof. Anis. So just scrolling through the question and answer here to see whether we have more questions from the participant.
We have one question here, Hida. I've tried to look for RA or GRA since last year, but I get none. What should I do now? I think that was what I was alluding to earlier. I think one of the lecturers came up to us and mentioned something similar, not necessarily the same thing. But I think what you can do, there are a few things you can do. Firstly, you can contact I-PPerForM, for example, and you can see whether they've got a bank, because they've got a bank of RAs that they have rejected, perhaps, and you might be able to get a candidate from there. Other than that, perhaps you want to look at your team members, or you want to invite someone else to join your team members, and then see whether they have got some communication with some potential candidates. The other thing is to approach the alumni. We have a postgraduate student alumni, and you can ask them whether they've got contacts that are interested also. So, and then the other things are a bit more broad in terms of putting up your details in the website. We've got the faculty website, we've got the PG website. You can, and we've got a research website as well. So you can, but that one's more it's very public, so you might not be able to get a good response. So I believe word by mouth is probably more effective. Okay.
Yeah. Thank you, Prof. Rohana, for a very good tips. All right. So we're coming to the end of our forum.
If I may add,
oh,
Dr.
yes.
Hida,
sure.
Regarding getting RAs during the pandemic, because we had challenges ourselves. As I mentioned before, many of the grants that we have actually were granted just before the pandemic. So what I did was, there are several strategies to do this, and alhamdulillah, we managed to get GRAs and even RAs recruited during the pandemic for our project. You need to be using all the channels available to us nowadays. So social media is one of the most effective ways to do it, rather than formal channel. I know formal websites is also good, like our PG office offered us to advertise it on the faculty website, for example, which is very, very good. But use social media. For example, I'm quite active on Facebook. So I put on my own Facebook. I actually created Facebook for I-PPerForM as well, and co-manage it with our I-PPerForM staff. So we put it on the I-PPerForM Facebook as well as our department. Our department has got a Facebook page as well. So we use that. And we also use IPSIS, because Associate Prof. Dr. Aman from IPSIS also offer to advertise getting RAs or GRAs for us. But the key is you need to do a poster. So do an attractive poster and then put it all the requirements of the candidates that you want. Put the stipend there, because once the candidates actually see how much they're getting paid, they will be interested. Hopefully they will. I mean, we've got interested people all the time. So for example, I pay my RAs 1,500 ringgit. And for MSc, we pay 1,800 ringgit stipend every month. And for the PhD candidates, we pay 2,005. So this is all in accordance with the KPT regulation and according to the grant requirement as well. So put it in the advertisement and make sure it's attractive, and they've got a contact number or email address. So after doing this, I actually got more applicants than I need, to be honest with you. And in between the pandemic as well, there were windows for us to actually do a face-to-face interviews. I remember sometimes last year, we even managed to do face-to-face interview for our RAs and GRAs. And that's how we identify, committed and focused students whom doing the projects with me now. If you're listening, we've got Aisha, we've got Johan, we've got Sharifah, we've got Mariam Hana. So they're all very, very committed towards the project, because face-to-face interview is very, very important when you actually select your potential students or RAs or GRAs. And another thing that I use personally is actually personal contact, because all these RAs, they've got personal contact. Many of the RAs that I have hired are actually our ex-medical students, our for research assistants. They're not GRA, they are RAs. We've got a pool of medical graduates who are waiting for housemanship. So you just have to get to know the right contact, because once you have the poster, the flyer, they will post it in their many other WhatsApp group of FB. And by the word of mouth, it will ripple through, and you will get to the recruitment going. Another thing that I must stress is actually the reputation of the PI and supervisor as well. I think the RAs themselves, or the GRAs, I'm sure you're talking among each other. Who are the good researchers among us? Who are the pushers? Because I'm sure all of the RAs and GRAs want a successful project, right? You want somebody who's passionate, who's gritty, for example. So if you're that kind of personality, I'm sure you want to find a supervisor who's just as gritty to make sure that you GOT. So I think the word of mouth of the track record of the principal investigator as well as the supervisor plays a key role in whether you are successful in recruiting your RAs and GRAs. So that is up to us to build that reputation. I know I can be scary to many people, but people who have worked with me know how passionate and caring I can be towards all of my RAs and my GRAs. Thank you.
Yes, couldn't agree more with what Prof. Adis has said, being one of her mentee myself. So, well, now we have the results of our poll here. So we have 37 participants who responded. Majority, about 95% thinks that definitely keep going with the research is ethical. While, we've got a minority, about 5%, two participants think that perhaps it is unethical. Okay, so this is definitely the end of the forum. I think, well, I'm ever thankful to both panel for their enthusiasm, for their experience, for their wisdom, sharing with us, how they perhaps overcome the challenges and difficulties in their research during COVID. So if I could summarize a few take-home message for all the participants, number one, in your planning, especially those who are just about to plan your research, the COVID is going to be here for a while. So definitely think about your duration, think about your inclusion, exclusion criteria, avoid perhaps I probably shouldn't say that, vulnerable group. If you think that the research is essential, you can still do it, but think about your recruitment procedure. Make sure that you consider the difficulty. Where are you going to source them? If you can't do online, so think about your methods of your recruitment. How are you going to locate these people? And lastly, think about the possible problems that you may come across, and then if you have to amend as quick as possible, so that you have enough time to, I suppose, receive your approval for amendments and resume your research. So with that, I suppose we can end the webinar. Thank you very much for the participants. Thank you again to both panel, Prof. Dr. Anis and Prof. Dr. Rohana, for sparing your precious time with us today. So the video recording, or actually, if you go to the central website, it is on Facebook Live, so you can watch the forum again there. And with that, thank you. And just one last, I suppose, message from the host. Please don't forget to sign in for your CPD. Each participant will get UiTM CPD as well as the MMC CPD. Yeah? All right.
Okay.
Thank you very much.
Thank you so much.
Thank you very much, everyone. Thank you to all participants for joining us this morning. Thank you, Dr. Hida. Thank you, Rohana. Thank you, Ms. Najmin. Thank you.
Thank you.
And congratulations to Secretariat.
What an exciting discussion we have today. Thank you, everyone. Thank you, our panelists, Prof. Anis, Prof. Rohana. Thank you to our moderator, Dr. Nurhida. And thank you to all the participants who is joining us today. You can find the link for attendance list in the chat box. And you can also scan the QR code that will be provided in the last slide. Well, that's all the time that we have, but please spend a minute or two while you're filling in the attendance list to watch a video on Center and how you can find us on the Faculty of Medicine website and check out the service that we can offer to the faculty members. So with that, thank you again for joining us today and have a nice day. Remember, lindung diri, lindung semua. Assalamualaikum.